Do you want to learn how to develop your clinical eye? Or do you want to become an ICU nurse in the near future? In this video, I'm going to teach you the right assessment for patient with congestive heart failure. Hello mga kaberks, I'm your nurse on duty. I'm back for another topic. So please follow my channel, like, subscribe, and click the notification bell. Don't skip, tapusin niyo po yung aking video. This topic is more on the pathophysiology ng congestive heart failure that will help you to become more effective in assessment and managing patient at bedside. So stay with me. Let's discuss congestive heart failure. So let's try to classify yung heart failure. Kasi yung heart failure, naka-classify siya or differentiate according to the pathophysiology. Let's try to differentiate yung right side or left-sided heart failure. So yung left-sided heart failure is the result of ineffective left ventricular contractility na magdi-lead siya sa pulmonary congestions or pulmonary edema and magdi-decrease yung cardiac output. So let's try to understand first the normal physiology. Diba yung left ventricle is the one responsible para mag-push ng blood sa circulation. Ang tawag natin doon sa lumalabas na blood coming from the left ventricle is cardiac output. So, mame-measure mo lang siya kung kulang siya or sobrado yung lumalabas sa left ventricle based on the computation ng heart rate times yung stroke volume. Yung heart rate, example, meron kang 80 beat per minute. At yung stroke volume is constant to 70 ml. In some references yung ginagamit kasi nila. So, 80 times 70, that is 5,600. So, it means that is the required cardiac output. Coming from frank starting low, na kung ano yung pumasok na amount sa receiving chamber. Ang receiving chamber natin, back to our normal anatomy and physiology, yung receiving chamber natin are the atrium sa heart. Yung ventricle naman natin is tinatawag natin siya as dispensing chamber. Receiving atrium, dispensing chamber is ventricle. So yung cause ng congestive heart failure or manifestations, it would be based on it's either structural ba siya ang problema niya or it could be functional abnormalities. Yung sa structural kasi, like example, pagbibigay tayo ng example, yung valve stenosis or regurgitation. So, kung may problema yung valve, so hindi siya magko-close, so may mga excess at may mga retention ng fluid. Pag functional naman, pag mayroong arrhythmias, may tachycardia, nagkaroon ng myocardial infarction, so the heart will not be able to pump well, or mayroong cardiac tamponade, may excess fluid in between the lining ng heart. So what will happen? Compress yung left ventricle, so hindi niya ma-push yung sufficient cardiac output into the circulation. So what will happen? So, ang mangyayari, magbe-build up yung blood pabalik sa atrium from left ventricle to atrium and sa lungs. Bakit nagkakaroon ng problem? Yung pag-stretch ng heart, hindi niya ma-stretch ng maayos. Like, sinasabi ko may inflammation or kaya mayroong ischemia or mayroong myocardial infarction. So, yung heart hindi makapag-pump ng maayos or ang reason is compensatory mechanism. Yung left ventricle, masyado siyang kumapal dahil sa haba ng panahon na nagko-compensate yung heart, kumakapal yung myocardium. So, yung loob ng left ventricle is not sufficient for the number of cardiac output na dapat niyang maipump every contraction. Another reason is if there is a blood retention. Since the heart will not be able to push or stretch enough para ma-push yung sufficient blood na nasa content niya or nasa loob ng ventricle, pwede siyang mayroong retention. Pag mayroong retention, yung 70 ml stroke volume, ang nailabas niya lang is 50. So, mayroon siyang 20 ml retention sa left ventricle. May retention din ang atrium. Kasi din sa frank starting low, ilang amount ang pumasok sa upper portions or receiving chamber in the right atrium, siya din yung dapat lalabas hanggang sa left ventricle. Pag hindi na ilabas lahat, so ibig sabihin may retention, yung tinatawag natin na backflow, build up of fluid. So, usually, pag left congestive heart failure, it may leads to pulmonary congestions or pulmonary edema at magdi-decrease yung cardiac output. Right-sided heart failure naman is most common cause is profound backward flow due to left-sided heart failure. So, nagkakaroon ng peripheral congestion because of the abnormalities on the ejections or functions ng left ventricle. Yung terms naman ng forward and backward, pag sinabi mong forward heart failures is cause ng inadequate delivery ng blood to the arterial system. Merong terms na makikita ka sa pathophysiology na tinatawag nila yung diastolic and systolic. Nagkakaroon ng problema sa congestive heart failure during the contractions and during the relaxations of the heart. Remember, pag nagkaroon ng relaxations of the heart, that is the diastole, where yung blood papasok sa mga chamber, at yung systole naman is the contraction. Kung earlier or delay ang diastole or advance naman yung systole, so nagkakaroon ng arrhythmias. Kung mayroong arrhythmias, earlier or late ang contraction, so kaunti or insufficient yung lalabas na cardiac output. Sa ibang terms, makikita mo na yung systole is referring to the contractions or the pressures coming from the left ventricles into the artery, and diastole is referring to the pressures coming from the veins going back into the atrium. So that is how some of the terms that we need to understand in congestive heart failure. It may varies according to each pathophysiology and causes. Merong terms na tinatawag na low or high ventricular output. Pag low output failure, example yung myocardial infarction, so yung heart will not be able to pump well. Hindi siya makapag-contract ng masyado yung myocardium, so kaunti yung output. Or yung patient meron siyang hypotension or meron siyang hemorrhage. Ibig sabihin, insufficient yung blood sa circulation, kaya low output failure. Pag high output failure naman, example, or pregnancy or thyrotoxicosis. Sa thyrotoxicosis kasi, meron siyang tachycardia. And also, pag merong anemia, may compensatory mechanism since kulang yung oxygen supply because of lack of red blood cells. So, mag-i-increase yung cardiac rate. So, that is what we call high output failure. In both types, patients fully compensate for decreased ventricular functions. Let's discuss the pathophysiology. Yung heart failure is also known as congestive heart failure. Set siya ng manifestation that cause ng heart failure. Failure is not a disease actually, but it is a syndrome. So, it is an adverse reactions of some pathological disorder. So, yung cluster ng signs and symptoms na nagkakos ng impairment ng heart function sa pag-pump to support the circulatory system, or either nakarest ka or doing some exercise or during some activities. Heart failure develops when yung heart fails to profile. May results kasi ng build-up of fluids in the veins and tissues. So, yung manifestation of water retention and swelling is due to the build-up of liquid. Ang tawag na natin doon is yung edema, collectively referred to as congestion. So, impaired ejections can cause inadequate perfusions ng body tissues with blood leading to ischemia. Driving through this pathophysiology, na-discuss natin kanina, meron siya divided into right and left failure. So, pag left heart failure, as I mentioned, pulmonary congestion siya ang mga manifestation. Pag right heart failure naman, it's more on peripheral congestion. Sa left congestive heart failure, we know that the manifestation is more on respiratory congestion. So, yung first manifestation or these are the earlier manifestation, yung fatigue usually occur, decrease yung cardiac output. Pag decrease ang cardiac output, decrease din yung oxygen supply into the tissues and cells. The CNS will stimulate for the release of norepinephrine and epinephrine para mag-increase yung cardiac rate or contractility ng heart. So, mag-increase yung workload ng heart. So, kung titingnan mo siya, magkakaroon ng manifestation na tachycardia. And, i-stimulate din ng brain yung lungs na mag-increase ang respiratory pattern kasi ang alam niya, kulang ng oxygen. And those manifestation is called compensatory mechanism. Pag sinabi natin compensatory mechanism, it is an attempt to compensate yung inadequate pumping ng heart. The body uses basic adaptive mechanism, though they are effective naman for a period of time, but eventually become insufficient to meet the oxygen needs of the body. So yung earliest symptoms of fatigue, it will follows with dyspnea later on. Lalo pag nagkakaroon na ng congestions or fluid retention sa alveoli ng lungs, there could be poor gas exchange. And later, it may lead to pulmonary edema or lung congestions. And one of the manifestation or pathognomonic symptoms are frothy pink or white sputum. Pag insufficient naman yung oxygen sa blood, magkukause siya ng confusions and later magkukause ng dizziness sa patient. Sa heart naman, since nagkaroon ng tachycardia, yung muscles or the heart begins na mag-increase its muscle mass in order to strengthen the force of its contraction. Since nag-increase yung workload ng heart, it may result for ventricular hypertrophy. We know na ang normal anatomical structure ng heart, mas makapal yung left ventricle niya sa muscles. But through this compensatory mechanism, pwede siya magkaroon ng ventricular hypertrophy, which can lead to another sign and symptoms of left ventricular failures, which includes lateral displace ng apex beat. Pag auscultate mo doon sa different points where you can identify if there is some abnormalities or displaced na yung location ng apex beat. It is because of ventricular hypertrophy resulting for cardiomegaly. The signs and symptoms of left heart failure are objective. Meaning to say, kahit sa malayo or kahit hindi mo kausapin yung patient, makikita mo na kung ano yung mga pathognomonic symptoms. When I said pathognomonic, specific symptoms for a certain pathological disorder. Paano ka magkakaroon ng clinical eye? You need to read more and see to it na pinapractice mo yung kung ano yung nababasa mo. At napaka-importante rin sa nurse na dapat learning by doing. Kung student nurse ka pa lang, bago ka pumunta sa bedside at na-endorse na sa iyo kung ano ang klase ng patients mong i-handle, try to make some research on the case ng patient. It is very important para hindi toxic ang isang nurse. You know how to prioritize your patient. If ma-assign ka ng medical ward at makahandle ka ng case ng congestive heart failure, try to check and evaluate the conditions of your client. And you will learn a lot and you will develop your own clinical eye. Tingin mo pa lang sa pasyente, alam mo there's something wrong with the patient based on the manifestation. So you need to check for the signs and symptoms. Make sure na may downloaded kang app para ma-check mo on what is the signs and symptoms of this disease. And you have also an app for medications or drugs and solution para matulungan kang maging more efficient and effective in performing your bedside care. So sa advanced left heart failure manifestation, ang patient meron siyang dyspnea or difficulty on breathing. So during the nurse's round, you will notice even in distance na mapapansin mo agad. Pag nakadevelop ka kasi ng clinical eye, magkakaroon ka agad ng clinical impression. So alam mo na pag may dyspnea, there's something wrong with the lungs. And it is associated with cyanosis. May dusky color ba? Because it indicates that there is a poor gas exchange and decreased oxygen supply. Some of the objective symptoms like dyspnea, petting edema or pedal edema, the patients may have cyanosis. Meron ka na agad ng objective symptoms. Adventitious sounds like rustls and crackles. So, kailangan mong i-auscultate, familiarize with yourself kung ano ang tunog ng rustls at ano ang difference ng crackles, yung parang nagpa-pop up, and you can hear at the back ng patient, sa may lower portions ng back, kasi nandun sa base ng lungs ang congestion. The patients may have occasional coughing or persistent coughing, and you will notice that yung sputum niya, it's either pink to whitish fruity sputum. That is also one of the pathognomonic symptoms of pulmonary edema. So if you're still here in my channel, it means you were learning on my discussion. So like, subscribe, and click the notification bell para ma-notify ka on my next video. I will assure you po that you will learn more and worth it ang bawat discussion. So kung meron siyang dyspnea at meron siyang tachypnea or increased breathing pattern, it means there is an hypoxia. So paano mo malalaman kung meron siyang hypoxia? It is associated with cyanosis. Saan mo hahanapin yung cyanosis? Titingnan mo sa nails ng patient kung dusky ang color, pwedeng sa skin, pwedeng sa earlobes or sa lips, pero sa mga exams, ano mo ma-check agad na meron siyang cyanosis? Makikita mo siya sa oral mucosa kasi manipis siya, so madaling nag-a-appear yung cyanosis. So yung patient, symptoms na sasabihin niya may tingling sensation sa lower extremities. And when you touch the skin of the patient, cold, clammy yung skin at pale yung color ng skin ng patient. And there is of course a presence ng edematous on a certain part ng katawan ng patient. You need to try to check the pulse rate ng patient. Kasi sabi natin decreased cardiac output, so try to locate the different site or pulse site. And you will notice na pagdating sa may mga peripheral system, meron na siyang 3D pulse or easily obliterated pulse. It indicates decreased cardiac output. So for early assessment ng hypoxia, always put yung pulse oximeter so that you can get the auto saturation. Normal auto saturation is 90 to 100. So as you can see in the picture, yung patients meron siyang congestions or lung congestions at may difficulty on breathing and cyanosis in the peripheral system and orthopnea. Another one is the paroxysmal nocturnal dyspnea, a sudden nighttime attack of severe breathlessness, usually several hours after going to sleep. Bakit nagkakaroon ng orthopnea at paroxysmal nocturnal dyspnea? Usually nag-o-occur kasi ito at night, no? Pag nocturnal dyspnea, difficulty on breathing sa gabi. Sa patient na may congestive heart failure, pag nag-flat yung patient, alam natin na congested na kasi meron siyang pedal edema, meron siyang pulmonary edema, meron siyang ascites, at yung ibang organs niya is enlarged because of the presence ng fluids. So, pag nag-flat on bed yung patient, nagre-redistribute centrally yung fluids na sa katawan, nagkukos siya ng back-up of fluids in the lung. Nagkakaroon siya ng pulmonary edema at nagmamanifest yung mga symptoms of difficulty on breathing. At nagkakaroon pa siya ng nocturia. Ang nocturia, sa gabi siya, mas marami siyang Bakit sa umaga meron siyang oliguria at sa gabi naman merong nocturia? Same reason with orthopnea and paroxysmal nocturnal dyspnea. Kasi yung accumulations of fluids sa morning, nagbi-build up na siya sa gabi. Since naka-activated yung ADH or meron siyang oliguria, nag-build up na yung fluids. So, yung patients hindi siya makatulog, meron siyang persistent coughing, difficulty on breathing, urinations at night. That is why it may cause further complications because the patients will not be able to rest. We need to auscultate also yung heart, and you will notice heart murmurs, like yung presence ng gallop rhythm, and there is an arrhythmia. Possible yung ischemia, expected then chest pain. So that is the advanced signs and symptoms ng left heart failure. Right heart failure is the complications of the left heart failure, and most of the symptoms is objective. You can observe even at a distance some of the manifestation or congestions that appears sa patients na may right heart failure. So paano nagkakaroon ng congestions? If congested yung left atrium, at the same time congested din or there are blood retention sa right atrium and right ventricle. So, ibig sabihin, hindi ma-accommodate ang lahat ng blood coming from the different parts of the body, which is the unoxygenated blood. So, kung hindi ma-accommodate yung lahat ng blood, it will stay or build up in the veins, which leads to increased central venous pressure. Pag nag-increase ang pressure inside the vein, can push fluid out of the veins into the surrounding tissues. So anong mangyayari? Magkakaroon ng build-up. It's either in the organs, like example, presence of ascites, enlargement ng liver, or a congestive hepatomegaly that may impair liver function. Sometimes patients ng CHF may mild jaundice, even yung coagulopathy or problem of decreased or increased blood clotting. So, nagkakaroon ng dysfunctions ang liver. During palpation, so mayroon siyang liver enlargement and spleen enlargement or congestive splenomegaly. Yung jugular venous pressure is frequently assessed as a marker ng fluid status kasi closer siya sa may right atrium. So, pag nag-i-excess yung fluids, ito yung indicator ng circulatory overload. Whereas sa makikita mo na meron na siyang pedal edema, which is a hallmark of right heart failure. Sa kidney naman, when the renal perfusions decrease caused by ng decrease ng cardiac output, yung kidney assume that there is a hypovolemia. So yung CNS, ang gagawin niya, i-inherit niya yung compensatory mechanism, i-activate niya ang renin. Yung renin, ina-activate yung angiotensin-aldosterone system or renin-angiotensin-aldosterone system. So what will happen? Yung angiotensin mako-convert into vasoconstrictor. So tataas ang blood pressure. Presence naman ng aldosterone, it means it may leads to more sodium and water retention. But since ang kidney assume that there is a hypovolemia, i-activate niya ngayon yung antidiuretic hormone. Ang antidiuretic hormone, kinokontrol niya yung urination. Supposed to be every hour, meron tayong 30 to 50 cc urine output. But if activated ang AD, so magkakaroon ng oliguria. Pero paggabi, nagkakaroon naman siya ng nocturia. Nocturia is the frequent nighttime urination. Bakit paggabi at hindi sa umaga? It may occur when the fluid from the legs is returned to the bloodstream while lying down at night. In progressive severe cases, yung same with patients na may ascites or fluid accumulation sa abdominal cavity causing ng swelling, pag naka-flat on bed na siya, nagkakaroon ng more congestion sa lungs. So that is why yung patients nagkakaroon ng dyspnea. Thank you for watching. Sana marami po kayo natutunan. You can check some of my videos. You can visit and support my channel. Don't forget to like, subscribe, and hit the notification bell. I'm your nurse on duty. Until next time.